Don't do what they do. My allergies are still out of control. She got it from you. What? The moth, yeah, and you ready to talk? Oh. Like, that's what I have.
I can't afford it.
You still got that phone. Oh, she kind of laughing at her.
Give me a second. Make you feel better.
Maybe a shot.
Yeah, let's do a shot. Malibu. Okay.
A little bit more. Like, come on, that's like.
Good evening,
like
Facebook. I'm your host, Menda Renee.
Wanda Li.
Etienne.
And this is Ratchet T. We're gonna hold on, wait. You gotta wait for me.
I'm taking a shot.
I'm trying to take a shot with you. Okay, this is Menda Renee.
Sorry.
Wanda Li, Etienne, Ratchet T podcast is Wednesday night, 8:00. Let everybody know that we are on. So we're gonna wait a minute or two to see tell your friends that we are on. We have a special guest tonight. We are talking tonight about healthcare workers and first responders, frontline workers. And here, you're gonna have to pour her another one.
No, hers right here.
Oh, where's yours? Okay, so while we're waiting, me and Wanda Li will be taking a shot of Malibu. So you know what the deal is. Today is Wednesday night.
I just took
pour yourself.
She just shot it.
Pour yourself your favorite drink. And if anything pertains to you in this topic, sip, and then jump in our comments because that's what we love.
Hey, Brittany. Hey, Cindy. Hey, Sad.
Okay, we got our comments going. Okay, so while we're he can be the bartender. Okay, so while we are waiting,
why are you not taking a shot?
You know, there's no calories in that. I'm just saying.
No, okay. I got a game right after this.
Okay, so here we go.
A game of what?
Basketball. I'm in the league.
Okay,
what league?
So while we're waiting,
what league? Who put you in the league?
You know how many leagues I play in? You think I suck
the
at
short
sports?
bus? Come on, just take a little bit. No, why you keep? I already got some.
Where's yours?
No, it affects me.
Okay, well listen. While we're waiting, me and Wanda gonna take a quick little shot of Malibu. So here we go. Salud. She's sick, so you know.
Hold
on.
I'm not sick.
Not with COVID allergies.
My allergies.
Well, I need a shot now. You know, it helped. You know, island people.
Yeah, come on, give some of that.
Took a shot.
Nah.
Yeah, here we go. Ready? We're gonna all salute together. Ready?
My allergies.
1, 2, 3, salute.
He's like,
salute.
All right, that's it.
Was I smoking weed? I'm like, bro, I don't smoke weed.
I got some oils.
Oh my God.
The foolishness.
Bro, that is.
How many shots you had? One?
I did. And I need it.
You had one.
I ain't gonna lie, that's
and
delicious.
I had two.
I got goosebumps.
Talking to him. Okay, so here we go. Okay, that was all in other areas that was not supposed to be. Okay.
In your hand?
It went down my chest. It was supposed to go in my mouth.
In my chest. In my throat.
That was an amateur move right there. You know what I'm saying? That was an amateur move. So okay, so here we go. We're gonna go up to date. We're gonna go up to date in 8. So here are your trending topics for today. In sports, Tampa Bay Buccaneers and the Kansas City Chiefs going to the Super Bowl.
55.
You made money on that, right?
Hell no.
Who you get?
What you know?
Last week?
Yeah.
The Bills?
I called the Bills and the
we knew that.
Girl, whatever you want, I'm rooting for you.
I called the Bills and Tampa Bay, but
it's Kansas City. Come on, Patrick Mahomes. Hoop, holla, holla.
2 years in a row.
They're gonna take it. They're gonna take it all. So yeah. So if anybody want to bet on the game, you can hop in my DMs and we can make some bets.
Okay. Yeah. You say hop in my DM. You know what that. You know.
So what do we do? What do we do at Super Bowl Sunday?
I don't know. We'll figure that out.
Y'all gonna invite me?
No.
It's okay.
I'm kidding.
It's okay.
I'm kidding. I'm kidding.
You invited me to that bowling game one time.
Yeah, and you didn't.
Last minute.
You didn't show up.
No, like same day. Hey, can you come?
This is true.
So you did. What did you do?
Same day.
You was invited. Oh wow.
Same day.
Okay. In other trending news, 5 teenagers who live in Louisiana stabbed and killed another teenage girl at a Walmart.
Mm-hmm.
They killed the girl by utilizing stolen knives from the Walmart. The girl was took to the hospital where she was pronounced dead, and now they are all facing second-degree murder.
As juveniles?
12 to 14.
So as juveniles?
As juveniles. One of them, I think, is 15, and they're trying to get her as an adult. So hide your knives from the kids and don't let your kids go to Walmart. That's all I got to say.
That's sad, man.
No, those kids, their ass should have been beat. How about that?
Butt ass naked.
That's what happened with the baby. Remember the baby? When he was with his kids at Walmart and Buddy ran up on him, he killed him right in front of Walmart. And he wrapped around on his song.
So that's crazy.
Huh?
Yeah, the baby. He's the only guy that can say that. I killed him in front of my kids, and then and he made millions on the album.
Okay.
Same thing happened.
But he was trying to get robbed.
Right.
The baby? No, they wanted to bark. He's like, okay, you want to bark? I'm a bust. He started busting. Bop, bop.
Well, I thought he was getting robbed. That's
kid.
what I thought. But I don't know. Whoever knows the story, let us know.
He still did it at Walmart.
Okay, I don't know. I don't follow the baby, but holler back to the baby. Okay. Finance news. February 12th, everyone, is tax season. That's when the official kickoff of taxes will be received by your IRS. So make sure you find your accountant and get your taxes done. Always call Right Now Business Solutions. You can call me at 561-299-4100. Always got to plug it in. Right Now Business Solutions for all your tax needs.
Plug it in.
Plug it in. I'm A1. I'm A1 if I have to say so myself. Okay. All right. In other news, I find that I did this especially for Etienne because he can appreciate this. So I was going to fashion today. So today in fashion news, I found the 10 most expensive Nike shoes in the world. Y'all ready?
Yeah.
Here we go. Number 10, Michael Jordan shoes.
Of course.
$4 million. He got a pair of shoes that's $4 million.
What, it came in the gold case?
I don't know what it comes with. I'm just saying it's $4 million. Number 9, Rory McIlroy.
Oh my God, the golfer.
Yeah, number 1 golfer and 4-time major champion. $6 million for these shoes.
What they got, gold in it?
I don't know. Number 8.
He put his jacket in there?
Number 8, Tiger Woods. $10 million.
He got shoes.
He's still making money?
He make money and he got shoes. How about that? $10 million. If you got to go get some. LeBron James. Number 7, $12 million.
I know his shoes.
Are these like add up of like, is that
these are probably those one pair of shoes
this is
that
for
they
one
wore.
Nope, this is just one pair of shoes that it's like exclusive
on auction.
It's like exclusive, like you can't even buy these shoes. There's one pair, $12 million. You got to go get them.
No.
Okay, number 6, Rafael Nadal, one of the best court players, also a Spanish legend. Yeah, $15 million.
He get all the girls.
Number 5, Derek Jeter, $16 million.
Baseball player.
Yeah. Number 4, Maria Sharapova.
Oh, that's that chick.
Russian tennis player. Her shoes cost a cool $18 million.
What the fuck do they got pom-poms on them?
I don't know. Number 3, Kobe Bryant. $20 million.
That's the highest, ain't it? 40 million was the MJ, right?
4 million was MJ.
Oh, so Kobe, okay.
Yeah. Number 2, your boy, Kevin Durant. $21 million for this one pair of shoes.
He is a vice.
Yeah.
His shoes are usually ugly.
All right.
They all look the same.
And your number 1, Roger Federer, $23 million. Swiss tennis player.
That guy retired like 5 years ago.
I'm just saying, if you got some $1 million that you just want to go ahead and spend, go ahead and get these shoes. These Nikes.
Case and put them in auction.
Yeah.
You gotta go more.
Yeah. So that's your up-to-date in 8.
I'm pretty sure they sweat in them too.
I don't know. I think these shoes are like one of a kind. Like there's only one in the world. Like you're never gonna wear them.
It's just to look at it, be like,
yeah. If I spend $23 million on a pair of shoes, heck, if I spend $200 on a pair of shoes, they're gonna sit right there.
everywhere you go, you just put this.
You put them in a case,
right next to you.
See my
do
shoes.
You guard them with your life.
You see that Mission Impossible crap? You know how you got the lasers going in there. It's okay.
So
it's crazy.
But yeah, so there you go. Yeah, so that's your up to date in 8, and now you're with it. You're up with it.
Yeah, up to date.
If you got some millions that you just got sitting around in the bank, go ahead and copy a pair of them shoes.
How about
cop me a pair?
How about listen to the first show, How to Make Money with That? Facts.
Right, Cindy. She said, I hope those shoes come with a mansion and a car.
Facts. Well, yeah, because that you're spending all your money. Well, you're spending all your money for your mansion and your car. That is your mansion and your car.
That comes with some stocks.
So that's your up to date in 8. So our topic today is healthcare workers, first responders,
respect,
thankless job, thankful job. What y'all thinking?
You said thankless?
Yeah, thankless.
Like
a thankless job.
Like you're not even thinking. It's just like you're just going through routine.
No, like how people treat our healthcare workers.
Okay.
You know, like remember we kind of touched on it a little last episode, and we talked about how people when they sick, they don't care.
They don't care.
They be like, you're the nurse and you come in and you try to take care of them, do the best job you can, and they like, F you, give me my pain medicine, fuck, give me my stuff.
Those are usually like people depressed, man.
No, it's not like that. It's like that from the time they walk in, from the time they register in, from the time they are asking somebody to be seen, all the way until they get triaged, see the nurse, see the doctor. Some people are negative from the time they walk. Yeah. And some of them, sometimes you'll see people that are actually TIAs or
what's TIA?
Stroke alert, or coming in with a heart attack, and they're way more calmer than the people that's there for a stomach ache or something like that.
Like the bases I see with the dilated.
Yeah. Some people come in asking for payments, but you know,
we got some comments going on here. Wanda Li.
Let me see. So said nurses never get the credit they deserve. Doctors don't do anything compared to what nurses do, and that is correct. But the doctor will get way more respect than that nurse is.
Absolutely, correct. Because they feel like they went through more school and got more knowledge.
The patient that gives the nurse this attitude, when the doctor come in, that shit shut down.
Really?
Right. A lot of times.
Why is that?
Because they just feel like the doctor is who's going to be there to take care of them, when it's actually the doctor. All he's going to do is see you, put that chart in, put them notes in, push that, or to give this patient this, and that. And the nurse is the one that has to go back out there and give you the meds, do everything. The nurse,
and you got to deal with me being all nasty.
Right.
I'm constipated.
Yeah, it's the nurse that's dealing with everything.
I need some.
So Jay said it ain't all bad, but I can't stand the people that abuse emergency services, which is correct.
What does that mean, Jay?
So,
when you abuse emergency services, I don't know what that means.
There's people there's frequent flyers, what we call frequent flyers, that come in there all the time. There's sometimes that you see a patient come in and you know somebody first and last name. You already know what they're there for, because they're there for the same thing every time.
Who paying that bill?
Medicaid.
Okay.
The county, it depends on, like, you know, Indian River County has a county program, so the county pays for it. They have no insurance.
I ain't gonna lie. That's, you know, so I had a situation where my gallbladder went out.
Mm-hmm.
Like he said, Brandy is like preaching, going all over here.
Oh, his wife. So I remember my gallbladder went out, and I had emergency surgery. You know what I'm saying? I almost wasn't here. Mm-hmm. And then they nicely gave me like a $60,000 bill and was like, here, this is for you, because you didn't have no insurance. Here you go. We took care of you. We saved your life, but now you got to pay the $60,000 bill. And I was like, no, ma'am. Put that on my good credit. And I'm not talking about a credit card. Put it on my credit, and I probably won't, because I couldn't afford it. So then this lady, I remember at Traditional Hospital, shout out to Traditions, to that lady that helped me.
Which is now Cleveland Clinic.
Is now okay, there we go. And so she super helped me, and she was like, listen, I'm going to get you Medicaid to take care of this bill. And she got me Medicaid for like 3 weeks or 4 weeks to take care of that bill.
They'll do what's called an emergency Medicaid.
That's what's up.
To cover some of that.
She covered it all.
But she covered it all. Some people don't.
Who's the people that come in after you get admitted for a while and you're there for a few days, and they come in with like, they want your paperwork, your like insurance stuff.
Yeah, that's registration.
That's them, right?
Yeah,
that's the pain in the ass.
But they're the ones that will also, if you don't have no insurance, they'll get you on to the next step to get somebody to come in and do a Medicaid application, screen you for Medicaid, and see if you qualify for any of that, or the county.
Yeah.
And then you have some people that come in that's like, we're trying to get you up out of here.
We
got somewhere to go.
Listen, we must have a lot of nurses or people in the healthcare because these comments, I just see them like flying through.
Right.
I'm like, what is going
Jade
on?
said, I guess, calling when they have other means of transportation. Ambulance are for those who are dying or dead or have no means of going into the hospital. Correct. There are people that call an ambulance for the dumbest fucking shit. Excuse my language.
No, I hear it on the phones all the time, like the.
They'll call for a toothache.
Oh,
they'll call. Yes, they will come in for a toothache. People feel like if they come in on an ambulance, they're going to be seen faster.
But that's not true.
But it's not true because 9 out of 10 times, if you get triage and it's non-emergent, you're going right back to sit in that lobby with everybody else.
No people actually died.
That's right. Sad said, Wanda is straight facts. I lived this. I worked this. Been in that healthcare field since high school. Since I got out of high school.
Wow.
So
this is right up your lane, girl.
Right. So I worked in the emergency room. I worked at Indian River Medical Center in the emergency room for over 8 years.
I feel like we in good hands.
No, but it is. That's what it is. There's a lot of people that are just abusing the system.
Like, I feel like there's a lot of passionate people. Because I'm telling you, these comments like ding, ding,
right.
Ding, ding.
Jay said, Wanda, I love you. You're so right again. Right. They're just
Wanda spitting straight facts. Wanda, you're absolutely right. Oh, I'm speaking on Brandy's behalf because the story she told me had so much more appreciative. Oh my gosh, appreciative.
For nurses, especially and for thankless essential workers. I've been a licensed practitioner nurse for 32 years, and the politics when working in a nursing home is just ridiculous.
Oh my God. Oh my God.
Right. So you get a lot of appreciative for nurses when the patients are on the floors. Like when the patients are ER patients, they are more appreciative for the doctors because they feel like the doctor that's doing everything. Yeah. When you're on the floors, they're being treated one-on-one. They barely see the doctor.
Yeah.
The doctor come and do rounds maybe once a day, if that.
Well, I know that I have a history. I have a family that's full of nurses. I mean, in the nursing field. And I'm not going to lie. I heard a lot of stories growing up, and I was like, nope. I don't want to be in the nursing field. Hats off to everybody that are in the nursing field. But I say no because I don't like people that much. I might just kill you because you might say some craziness and I might give you too much morphine. Okay, you might be out of there. No, I'm gonna be honest.
But to a lot of these nurses, they have to know how to cut their emotions off because you can deal with racist people. Not even that. Some of the floors that they work on, the ones that work with with the kids, like you have to know how to leave your emotions at the door and not get attached to that. Some of that stuff hurts. Right. Dealing with the people that are like hospice. Yeah. That person is right. They're about to, pass away. So, you try to make them as comfortable as you can. Yeah. I know when my kids used to be in the hospital on and off, I never really cared for the doctor. I always cared for the nurse because she was going to keep 1,000 with me. And, the doctors just typically come in and they, let me just see. And then, so what's your pain level today? Anything change? Like 10. Okay, bye. That's it. Right. The nurses who
go ahead and give her ibuprofen or whatever and send them home.
And then sometimes the nurses are overworked.
Yeah.
I've had good experience.
They're like when they're 10 straight days sometimes.
Yeah. Yeah.
For example, I was in the hospital for 3 months, right? Mm-hmm.
But we have a nurse on the line.
Oh yeah, we have bring her on.
Let's bring her on so she could tell us.
Well, go ahead. Tell your story before we bring her on.
I was in hospital for 3 months because I had osteomyelitis in the spine.
What is it?
Osteomyelitis. It's like
tell them what it is.
It's an infection in the spine. Like it's a bone infection. Okay. Which spread out through my body, and I was there for 3 months. My bill came out to $1 million.
Oh wow.
I had no insurance, and then the nurses that came in, there's like, we can't kick you out.
They can't.
They said we can't kick you out, so you might as well be here a permanent. They called me a permanent resident.
Okay.
Do we have those?
Permanent resident, which was me. They gave my wife a key to all the doors to open, like get foods and stuff like that. Mm-hmm. You know what I mean? But the doctor came in. He was really in there with me for like 15 minutes. Guess what? The doctor was actually a friend of mine from high school, and I haven't seen him in 12 years. And he said,
"Did he do something for you?"
Yeah, he said, "Yo, look at it, take a picture of it, tear it up. We got you, bro.
Oh wow,
That's good.
Yeah,
There we go.
He
Now,
said,
all
we got
doctors
go.
are like that. They like, I want to get paid. I'm not
Right.
coming in here
And
just
this- and
to
this
use
what-
it free.
but isn't there, like, not to cut you
Go
off,
ahead.
but isn't there like a contingency or something for doctors? Like when they have to write stuff off, they still get paid, don't they?
Yeah.
It's not like
Yeah.
they get a short in their check.
Yeah.
Don't they still get paid? I'm confused.
Well, they're still going to get paid, but the hospital loses money. But they write it off.
Right.
They write
That
it
goes off on their taxes.
Right.
It's okay.
Yeah.
Because it's
But
going to
that's
be
why
right
a
up
lot
on the
of
taxes.
that's why a lot of them have the Medicaid programs,
Mhm,
and they have the indigent programs where
Mhm.
people, if you don't have insurance and stuff like that, you can try to qualify.
Check.
But they will check to see if you own a home, because a lot of
Right.
people abuse. That's the problem. Is a lot of people come in there and abuse the situation, and they'll say,
Yeah.
I don't have this, I don't have that. They'll have like 30 racks sitting in the bank. They own a home. So you're trying to take from somebody that really doesn't have.
Right.
So that's what the problem is.
Yeah. Well, what do you guys think? Do you want to bring on our special guest?
Bring it on.
So everyone that's watching, we do have a special guest. This is our actually first special guest, and we're super, super excited to bring her on. Her name is Brittany Richardson. She is a nurse in North Carolina, and she is super dope. I'm a little biased, okay? But she is super dope, and we're going to bring her on. And we're going to just have a conversation with her and talk to her and see how she, just dig into why she wanted to be a nurse. So coming to the stage, everybody put your hands together for Brittany Richardson. Everyone clap. We got to clap.
But do we got her in?
There she go.
All right, hold on. We're going to unmute her. There we go. Hey, Britt.
Hey guys, can y'all hear me?
Yes.
Okay, good. How y'all doing?
Good. So we're super excited to have you on Ratchet Tea Podcast. So welcome
Thanks
as
for
our
having
very
me.
first guest. Super dope. We really appreciate you, and our hats go off to you, not only to you, but to other healthcare workers and frontline workers. And our hats and hearts go out to you. I know it probably doesn't mean much because we're not there in the swell of everything with you guys, but our prayers and our love are definitely with all you guys.
Well, thank you. Thank you so much. It's really appreciated.
So my first question is, what made you want to get into healthcare? Like, was there a calling on your life? Like, what made you want to become a healthcare worker?
I feel, well, it runs in our family. My mom's a nurse, my grandmother's a nurse, and I knew, like, ever since I was little, playing with kids on the street, they would get scraped up knees and everything, and I would be there running with the first aid kit and everything like that. So I think it was just, it's in my blood. I think it's really just in my blood, y'all. Seriously.
Okay, so was there like some requirements? Because, we got people watching and, they probably want to know, how'd you become a nurse? Like, was it hard? What, did you have to go to school? Did you just pick up your license from a Cracker Jack box? Like,
oh my gosh. I wish. Let me stop. No, so I did go to school. It was a 12-month program. So I'm an LPN, which is a licensed practical nurse. I know RNs usually go to school for 4 years, but I did the 12 months, and it wasn't that bad at all, y'all. But not to say it's not hard, or anything. And I graduated with honors. Thank you so much. Thank you so much.
oh, yeah.
My
And I
question
won-
to you, Britt. Go
Yeah,
ahead.
and
Like,
I won
do
the
they-
Florence Nightingale award for my class in 2014.
Now, what is the Florence Nightingale award?
Some would call her like the founder of, like, medicine and nursing. Well, nursing, I should say, rather, and just nursing and bedside care. So it's like the highest, like, honor because, just embracing what a nurse is and caring for people and humanity, basically. So
Oh, that's super dope. I never knew. Because I'm not a nurse, so I don't know. I'm a number person. I'm the one to do your taxes. Call me. Holla back.
You said you had a question, Etienne?
Yeah. Is there like certain type of tests that you have to take, like for psychiatric, like to know if you're stable enough?
Not to get into not into my LPN program. No, definitely not. I know when you do get into, can you guys hear me? Hello? What? Oh, my bad.
Unstable internet.
Oh,
Oh, here we go.
Can
You're
you
back?
see us?
Here she comes.
Okay, I'm sorry. Yeah. So
It's okay. We're back.
okay, so yeah, not for like to get into nursing school, but a lot of jobs now are asking, like, on job applications, are you mentally fit? Are you emotionally fit? Are you not just physically fit? So I think I've been seeing that come along like the last 2 years. I've been a nurse for 6 years, and that really wasn't a question. And that really wasn't a question initially, but they've been asking that on applications recently.
Okay.
Yeah, now they're doing that background check.
The background
to see
check.
If you've been,
because we want to make sure that you're not,
or something like that.
We want to make sure you're not Dr. Kevorkian. You know what I'm saying?
Right.
But you know, like certain people after a certain amount of stress, they crack.
But that happens a lot.
Yeah.
That job,
But that happens a lot. 2 nurses on the floor.
Yeah,
That end up being Baker acted.
So let's talk a little bit about that. Have you ever experienced anything like that? Like been stressed out, overwhelmed, want to quit the job?
Yes, and Ben, say hi. And he kind of gets the brunt of that sometimes. I try not to bring it home, but you know, sometimes it's hard. The beautiful thing about, you know, nursing is that you have so many different avenues that you can do: psychiatric, mental health, you know, pediatrics, geriatrics. There's so many things that you can do. So I've definitely done HIV care, which I love. I've done Suboxone program, which is people who are trying to get off of drugs and they're using Suboxone. And sometimes those individuals who are like coming down new to the program, starting to take the medications, you know, they're like, well, I need my Suboxone. And then they're like, I'm like, well, you got to take your drug test first. And then once we get that back, then you can get your Suboxone, because you can't take Suboxone when you're actively using.
Did you say Shabbats?
No, Suboxone. I'm sorry.
I was like, Shabbat, hallelujah, Shabbat. I don't know what that is. You're speaking nurse terms. I have no, what is that? Tell the people what that is.
It's basically a medication that helps you taper and withdraw from like drugs like heroin, crack, cocaine, things like that. So,
what's methadone? Can I get some of that? I feel like that's something that
methadone is also used as well. Yes, it's supposed to help, you know, with withdrawals and things like that. But dealing with that population, and you know, they get upset and they'll try to blame you, like, well, if you don't give me my Suboxone, then I'm gonna go out and use right now. You know what I mean? And
so what do you do in that situation? Do you just give it to them?
Oh no, because we have to make sure that they're not actively using. So it usually takes about 24 hours for us to get the drug test back to show us if they have any drugs in their system. Yeah. So basically what you do, you just try to talk to them and say, hey, this is the protocol. These are the steps. Can you just hang in there? You know, encourage them to talk to their support system until they can get that medication.
Gotcha. So that's super dope. So because of due to the pandemic and, you know, have you seen a lot of COVID patients? Like what has your experience been with, you know, during the COVID pandemic?
Right now, I am blessed because I'm actually working private duty nursing. Oh. So I have private duty nursing is I have one patient, y'all. One.
What?
For the whole shift?
Yes, for the whole shift. And I do 10-hour shifts. And she gets all my attention. She's a 9-year-old little girl. She's the greatest. So my exposure to COVID is pretty low. Thank God right now. But my family and I, we did test positive for COVID about 3 weeks ago. So and all of us, Brandon was sick. My son, I was worried about him because he has asthma. But he had, although he tested positive, he didn't have any symptoms. I lost my taste, my smell. I was extremely tired. It was terrible. But we didn't get hospitalized, guys. So that's all that matters. And we're still here.
So what do you think you caught COVID from?
Well, okay. Although my risk is lower, the father of the little girl I take care of, he works in the prison. So that's more of a high risk, you know, population to work with. So I can't say if it was him for sure. You know what I mean? But I mean, chances are out there definitely, especially being a nurse, you know what I'm saying, working in the grocery store, you know, essential workers, the risk is definitely out there for sure.
Yeah.
What did you take? Did you give you any medicine for that?
No, they did not. They told me to quarantine for 2 weeks, which we did. And we just took probiotics. We took elderberry. We took zinc, vitamin C, things like that.
She didn't take no sea moss. She didn't take sea
Wasn't the sea moss? We didn't try that, but I'm pretty sure that probably would have worked.
It helped.
Yeah.
Well, that's awesome. Well, we're super happy. You guys are well and I'm back to recovery. Everyone's testing negative and.
Yes, we are good, and I'm back to work and everything because I don't want to put my little girl at risk because she has a trach, she has a vent, She has a feeding tube, so basically she has a hole in her throat that helps her breathe. And I don't want her to get COVID because, I mean, she's already on a vent. There's nothing more they can do for her.
Right.
You know what I mean? So
Yeah. Well,
yeah.
And I'm sure you're emotionally attached, right, Brittany?
Yes. And
When you work with certain patients, it is so heartbreaking. Heartbreaking.
In nursing school,
how to get sick.
Yeah.
I know I live in North Carolina now, but I did get my nursing license in New York State. And they teach you, don't get emotionally attached. You know what I mean? Because, they really push that. It's different here in North Carolina because, they do encourage you, you know what I'm saying? Like, these are your patients, get to know them and things like that. And so it's kind of an adjustment for me, but I'm always a loving, caring person. And how can you not when you deal with kids? You know what I mean?
For me, it's the kids and the old people. Because the older folks are like sweet babies. Yeah. No, they're like babies.
Yeah.
Especially the ones that don't have no family members around. Yeah. It is very, very hard.
Some of them kids are devils.
Some of them are, but
you want to know what, Auntie? The ones who can talk to you.
Right.
The ones who can talk that person out.
On top of your medication. I'm gonna give you some Benadryl and your medication. Good night, goodbye. My shift ends in 12 hours.
No.
So Cindy said her floor got hit really hard and they lost quite a few residents.
Oh, wow.
And she said you will get attached to your residents. So, right.
Isn't that good, though? I think it's a good thing. It is good,
but then it's not at the same time because it's hard.
I don't want to be a robot. It's like, I'm human, you're human, you're sick, I want to help you.
Oh, then what happens when you lose a patient?
I'll cry.
You just cry. You cry.
But it's okay. You're gonna lose someone, but at least I'm giving you all my love, all my attention. You know what I mean? Because if I'm coming in there, check. I hate that feeling. All the nurses that were like that, I got them out of my room.
Yeah. Well, let me ask you something. When you deal with patients like that and you become attached, right? Like with certain patients, when they pass away, do they leave you stuff in their will?
I have not experienced that, but I think if they do, we cannot take it.
We cannot take it if they do.
No, you cannot because you are paid for this.
What if you don't know? What if you took great care of them and their mom passed away and they said, hey, you know what? We want to leave you $5,000. You can't take it. You didn't know.
You cannot. No, you can't take it because we're paid to take take care of them.
It's a tip.
Yeah.
Right, it's a tip. We can't take a tip.
There's no tips in nursing.
So Brianna said that's why I like being a labor nurse. You bring a baby into this world and then ship them to the postpartum nurse. Laugh out loud.
Oh, I don't know what
okay. But what does she do if a baby passes? Has she experienced that? Do you guys know?
I don't know.
She's listening. So you ask her. Well, she's definitely listening. So this is a
Breeze. What do you do? Have you lost a little baby?
She doesn't want to be on screen. I asked her.
Oh, Breeze.
She said she has to work in the morning. So
yes,
I understand.
Yeah, but you have to have compassion.
Yeah,
you do, but not all nurses have compassion.
I know some nurses don't have compassion.
Not all nurses have it.
So now, Brittany, what field? Because I know you said that you're an LPN and you do private duty. Is there like is it a specialty that you do? Is it like just nursing in general? Like, tell the people.
I've done so many different specialties in nursing, and that's what I really love about nursing is because if you are like, I want to learn something new, you can go a different way. I started out doing family medicine, so that's ages 6 weeks to 99. So I got to do immunizations, STD tests, physicals, Suboxone, HIV. It was great. My specialty now, I do pediatrics. I specialize in pediatrics of children who are developmentally delayed. So children who may have spina bifida, cerebral palsy, any type of developmental delay. I love it. Seizure disorders, everything. I love it. I've also done long-term care. I do enjoy long-term care, but the thing is, it's a lot of work, which I don't mind working hard. I really don't. But I just feel like some facilities are just unsafe. You know what I mean? As far as nurse to patient ratio. I know y'all heard about that. I've had 34 patients one time, one nurse. Absolutely not. There's no way in your heart of hearts, no matter how good of a person you are, that you can adequately take care of 34 patients by yourself.
Now,
and do everything that you need to do.
now is that a scheduling situation with the company you work for? Is it lack of nurses? What do you think would cause that?
Trying to save money.
You're trying to save money?
You know, yes, I think it's definitely quantity over quality. You know what I mean? They're trying to get one nurse to do as much work as she can. You know what I mean? But that leads to burnout, that leads to mistakes, that leads to, you know, the detriment of patients. So I just didn't feel safe, you know, doing long-term care. That's my opinion. My mom, she does long-term care. She's been doing that for a really long time, and she has 20 patients. You know what I mean? But even so, she's been in this field for 32 years, and she said when she started out, nursing has definitely changed. The acuity, you know what I mean? Like, you have patients in nursing home who have G tubes, PEG tubes, you know, you're getting antibiotics, you know what I mean? So,
what, the colostomy bags? I know about the
colostomy bags, ostomy
because
bags.
somebody left it in the garbage at my job. It was disgusting.
Isn't that the one you run into the
Yeah, I don't understand that. Like, why would you leave your urine or your poo-poo colostomy bag in somebody's garbage? Isn't that like for if somebody has and I don't know if you know, I don't know if you know, Wanda. If somebody leave, I would assume if you leave your colostomy bag in the garbage of your work, that has to be like some biohazardous type of situation going on. And in that situation, what do you do? Who do you call the CDC? Like, who do you call? Or do you just take out the garbage and be like, oh, they ass stink? Like, what do you do in that situation?
I feel like it wouldn't be any different from like a baby's diaper. You know what I mean? And I mean, if your bag's full, you got to change it. Or if it's coming on, you just put a plastic bag and just take it with them.
Well, I'm just confused because the stick.
Right.
Okay.
That's why some people go to the emergency room to get it changed.
Yeah. I mean, the stench was horrible. It smelled like death. I felt like I wanted to find that person and actually kill him. Or because that was disgusting. They asked them. And I understand they had a colostomy bag. They got it for a reason. I get it.
Right.
But I ain't trying to be insensitive. But yo, whoever had a colostomy bag, you know who you are if you're watching. Okay. Don't put that in the garbage no more. Okay.
Maybe they need to wrap it up real good and some tissue.
And take it to the dumpster. Take it to the dumpster.
I don't know why why
yo, that's nasty.
Out in the public?
Yo, that's just
so let me get to these comments real quick. So Cindy said, I take care of 20 residents every day, passing meds, doing treatments, and everything else that has to be done for them.
That's not bad, right? Within the time frame, like you,
how long?
That's a lot.
Is 20 residents a lot?
She does 8.
8 hours.
Mommy does. She does 8 hours, and that is a lot.
That's not enough time. Then.
So in 8 hours. So in your opinion, Brittany, 8 hours, 20 patients, in your opinion, is not good.
No.
Because you can't give enough. Why? Because you can't give enough attention.
It's just not enough time.
We don't skip Etienne's cheese bus pills. I mean, and then we just got to you and we doubled up on you. I mean, what could happen in that situation?
Well, I mean, for Cindy's probably used to it.
Mm-hmm.
Right.
So for her, it's probably like a breeze because some people get used to having like a fast track, but it's really for nobody is going to want to walk in and have 20 patients.
Right.
Really?
It's a lot.
Because you don't know. I don't know if she has to change diapers. I don't know if she has to change their clothes, change their beds. We don't know if she has a CNA helping her. Like, we don't know if it's just her by herself with these 20 patients. Giving meds. If she has to change IV bags. Like, you don't know what she's doing and what she has to do for these patients in 8 hours.
Wow.
And on top of that, a lot of elderly, they have a lot of medicine. So you could be on one patient, have 20 pills for one patient.
So
and then, you know what I mean? Like,
so having all these patients,
diaper rash.
Yeah.
You know what I mean? There's just
so having all these
much.
patients is like you can have an error. Like you could give somebody else's pills because you forgot that Etienne needed his cheese bus pills, but you gave them to Wanda instead.
Yes, absolutely.
No, it can't. That's how errors are created.
Wow.
Question for you. Let's say, 8 hours, you have 20 patients. You still haven't seen 10. You're at 10. You got to run it through, right? Or how's that work?
Yes,
or is it
you have
to make it happen.
Right, exactly. According to the state when they come to a facility, you have an hour before and an hour after to administer medications. So say like a medication is scheduled for 8 o'clock. The earliest you can give it is 7 a.m. The latest you can give it is 9. Now that sounds good in theory. It really does. But the reality of that happening is slim to none. And don't have a fall. Okay? Because if you're in the middle of your bed pass and a patient falls, you have to stop what you're doing. You have to get vital signs before you get that patient off the floor. Get them up. If they hit their head, you have to do neural checks every 15 minutes. There's just not enough time. It's just not enough time to do everything that you have to do.
So would you be in favor, because you're saying that you don't have enough, sometimes you don't have enough time to do what you need to do. So is that why they have a lot of nurses working like 12-hour shifts, those 12 hours, like 3 days in a row, and then they give them 4 days off, or however the schedule is? Is that why they give them the 12-hour shift?
And I've done that too, Auntie. I've worked at a long-term care facility, and I've done 12-hour shifts. And even with the 12 hours, like everything did get done, but it's still a lot to do. Like, and that's with them being on my hall. I had 15 patients. Okay. 15, one aide for 15 patients. So not only she can't get 15 people up. So, of course I'm a nice person. So I'm like, okay, I can get this person up. I can help serve. I can medicate them. I toilet people. I shower people. It's just not enough time.
So do you guys like have each other back? Let's say, hey, I can't get to this person. Can you cover boom, 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 room 102, 105, 107? Or no, you got to be the one to handle that?
That is a good question. That's a great question. Because in a perfect world, there will be teamwork, make the dream work. But it all depends on who you work with. Seriously, and personalities and work ethic and things like that. And from what I've come across is some aides are just there for a check. And I'm sure some nurses are too. But, you'll say, hey, someone needs to be toileted. I'm in the middle of a med pass, or I'm in the middle of wound care. Can you take care of this person? And the aide will turn around to you and say, well, what are you doing? You can do it. You think because you're a nurse, you don't have to change nobody, but ma'am, I'm in the middle of wound care. Like my hands are busy.
And I got 18 other patients to take care of.
And you're in there charting them accounts, putting all your notes, because the next nurse that come in behind you, and the notes are not in there, she's coming for you.
I got another question for you, Britt.
Right?
Yeah.
She coming for you. You ain't got them notes in there, they coming for you.
What? Why? Oh, because they need to know what you did.
They're gonna say you didn't do your job, you didn't do this, you didn't do that, blah blah blah.
Because if you don't chart that you gave this person
their meds,
if you don't chart, it wasn't done. If there's no documentation, that means it was not done.
They coming for you.
Wow.
My question for you is, let's say you see a nurse not doing their job to the peak that you're doing it, and you can see that they're making errors. Do you report? What do? Do you check them and say, yo, you need to do this, bum, 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 or you just let them do the job and you just like, I'm gonna report this person to whoever, HR?
Well, I'm a very passionate person, and I have a real like A-type personality when it comes to caring for someone's loved one. So, but at the same time, I realize that people are humans, you know what I mean? And we often learn from each other. So I will approach that person the first time directly and just say, hey, I noticed this. Maybe we can talk about a way to do it more efficiently, to do it better. This is typically what the patient likes, and see if they improve from that. Because I don't want to just go and tell, HR, you know what I mean? Because it's like, dang, give me a chance. You know what I mean?
Yeah,
so I like to address people head on, first, but sometimes that's not always received well, although I mean well. But I'm like, okay, well, we've had a talk, so next time.
So do you guys have nurses beef? Is there like nurses beef? Does nurses beef happen in the hospitals and the nursing homes?
There's always cliques.
Brittany thinks she the bomb nurse. She ain't that good. Whatever.
Between the shifts, the morning nurses don't get along with the night nurses.
Why?
The night nurses feel the day shift.
Why? Y'all all there for the same reason. Y'all taking care of patients.
But you would think so. And I feel the same way too. You know what I'm saying? We're all on the same team. We all have the same goal in mind, but I don't know why. the night shift blames the day shift. The day shift blames the evening shift. It just goes on. And I'm just like, look, we're all here for the same thing. Let's just take care of these patients to the best of our ability, and let's just move on. You know?
Okay. So being a nurse, because I know there's levels of nurse like LPNs, RNs, and you have your nurse practitioner and all that good stuff. Is there beef between the RNs and the LPNs? Like, I'm an RN, you're LPN. You need that. I mean, is it stuff like that? Like, is it like, yo, I'm an RN, you the LPN, but y'all doing the same job? Like, I'm confused.
More degrees, I guess. That's what it
is.
Is, right?
Is that what it is?
A little bit more schooling.
Definitely with the RN, they definitely do more schooling. I agree too. I feel like even if you're CNA and LPN, RN, NP, MD, it shouldn't matter. I feel like we're all on the same level playing field. True, some people have had more education, you know what I mean? So I get that, you know, so they can, you know, practice it within their scope. But there is beef. I don't know why. I don't beef with anybody. You know what I mean? I feel like I get along with everybody, but for the most part, oh, she's just an LPN, or oh, she's just a CNA. What?
Right.
What is that about?
You peasant.
Well, here's
my
right. So let me ask you. So when you have, you know, because I say women are the devil. We are all the devil. Okay, we just the devil. We don't know how to conduct ourselves. Okay, we don't know how to handle ourselves. Okay, with other women. Okay, so when you have a nurse that's a male, do you find he's less catty or
which
less
is rare?
Drama,
we want the nurses.
Or they
we
still
love the
full of
nurses.
the drama.
No. We love the nurses. It's
what are they called?
Nurse. The nurse. It's a male nurse. A nurse.
Okay, y'all better get into it. Whoever's watching nurses. Okay.
We love the male nurses. You know why? Because they do take away from that cattiness. Seriously, you know, and they kind of bring like, you know, some level-headedness to the situation. You know, and you get a break from the drama. So yeah.
So we're gonna go into some of these comments.
So we're gonna go into some of the comments,
right? So Jay said treatment can be long, different meds to be handed out, not including those who are falling and fighting other residents.
Yes.
Cindy said that's a lot. I guess 20 patients is a lot when you are constantly running. Yes, I'm very organized. CNAs do care for the residents. Nursing field is just catty. They are beyond catty. And then Cindy said she said shots. She said not the same job. RNs do more paperwork and LPNs are more hands-on.
Oh, so y'all RNs don't work. That's what we saying in the comments. No, she didn't say that. I'm saying that. Y'all RNs don't work.
A lot of RNs are in administration. They are in administration. Yeah. So they're doing like behind the scenes paperwork. Yeah.
So I get it then. So I see it.
Charting.
So I see it. So if you're an RN, you're doing a lot of paperwork. The LPNs are doing a lot of work, and then the CNAs are kind of like doing the grunt work. Would you say?
Well,
is there like a level to it?
A lot of it depends on where you work. Like a lot of CNAs do most of the work than the nurses do if you're working in hospitals.
But is there a job as a CNA to do more work?
Well, they're certified nursing assistant. They're there to
assist the nurses.
Yeah.
So who's the highest level, like the nurse? What's the highest level?
That's nurse practitioner.
Yeah, PA.
So they're the ones at the desk. Just tell her.
No, that's the RN. The ones at the desk are the RNs.
So but then
you have the charge nurse, which is just sitting there saying, "You got room 5. You got room 12." These patients.
So
you got to get on my face and get up and get out that chair.
We got an ambulance coming. They're going to room 4. We got this.
Hold on. Let me ask you something. Okay.
And then you have.
And listen. No, hold on. Let me ask you something. And y'all and Brittany, you don't have to say yes or no because I don't want you to incriminate yourself. But are most charge nurses fat?
No.
Lord, I can't. I'm just
saying, are they mainly fat? Because if you're just telling me to do this and that, get up, and do some work. Won't you get some of these 20 patients I'm working with? Charge nurse.
But listen,
help me. Help you.
So in the ER, there's not a lot of charge nurses that are actual titled charge nurses.
Okay.
So what you do is you carry the phone for a day and you get $1 extra for carrying the phone and sitting there and just telling people what rooms to go.
So what's the phone for?
So the phones are so the doctors are calling you, giving you orders. If you're sending a patient up to the floor, you have to make sure that room is cleared. You have to make sure that the nursing supervisor is on board with you sending the patient upstairs. I don't know how they do it at nursing homes, or other places like that. But I know that's how they do it in the ER. Not everybody that is a charge nurse is like being a lead for the day.
Question, real quick.
We got a million questions. We're so sorry.
How do you?
But we
So
love it.
fine, guys.
No.
I'm off tomorrow.
So
She's off tomorrow.
What is out?
So since all the nurses have the same education, right? Let's say you're applying for the same hospital. How do you know I'm gonna put her at a charge nurse? I'm gonna put her here. I'm gonna put her. How do you? Do you go to?
Well, all nurses do not have the same education. So there are certain things that RNs can do that LPNs cannot do. Like, I know in New York State, LPNs can't even breathe on a PICC line, okay? So RNs, they can do PICC lines, they can remove them, they can insert them. We cannot do that. They can run the first dose of antibiotics and a couple other things that RNs can do that LPNs can't do. It's not much, but we still have limitations. And what was your question, Etienne? I'm sorry. How do you decide who does what?
Yeah, how do you determine, like, let's say I have a nursing degree and Menda has a nursing degree and we're both applying for a nursing job. Why would they put her at the charge nurse and put?
But they're going to go for your experience.
It's experience. Yep. They're going for experience.
None of you have experience, right? You don't have experience.
No,
there's
people
that work on different floors. Like, like, for instance,
I would hope you got experience.
Brianna right now is an L&D nurse, but she started out as oncology.
Yeah.
She can do both.
She could do cancer
and she could
do
labor.
And labor.
So you see, when I mean experience, when you mean experience, you mean like an internship, right?
Well, no, I think don't you guys do like school or something like that?
You go schooling and then you have to do your.
You do school and you do clinical rotation, so you might do a ortho rotation.
You go on the floor.
Yes, but
some people start as CNAs, go to LPNs, and then go into RNs.
Now, is that a good route to go? Would you think, in your opinion, Brittany, to go like CNA, LPN to RN? Or should you just go straight for RN? Like, just go straight for the jugular? Like, I don't know what I'm getting into, and I'm going to get into.
I think it depends on everyone's personality and that individual. If some people want to test like healthcare and they're like, I'm interested in, but I don't know, I think you should go for a CNA. To get your feet wet to see if you like it. Like, do I really like having to change somebody? No? Okay, then maybe healthcare isn't for you. You know what I mean? But I think LPN is like a midway point. You know what I mean? So like, okay, you know what I mean? So maybe I'll move on further, maybe not, who knows? But it all depends on the individual person. I know plenty of people who just went straight to RN, so that's cool.
Or I tell some young people start off as a CNA.
Yeah.
Because if
in high school,
if you get into a hospital as a CNA and you could do tuition reimbursement, some people don't have the money to pay to go to nursing school.
Gotcha.
So if you're doing through the hospital, they do tuition reimbursement. Some people can further their education through the hospital. You just got to sign on to do 2 more years or whatever. But at the end of the day, it's like.
So that's where the evil ones come from, because they got tuition reimbursement. That's where the evil nurses come through. They get tuition reimbursement. I'm just stirring the pot. I'm just saying. I'm not saying all nurses are evil. I'm not saying that because, like I said, my whole family, for the most part, are nurses. But I never wanted to be a nurse because I was like, I kill some people. I'd be Mrs. Kabuki.
A lot of the problem with the older nurses that you see and the younger nurses nowadays is that back then they just needed to be an RN, and a lot of places now you have to be a BSN.
That's true.
So they have a bachelor's instead of just having an associate. Gotcha. So a lot of them, they just feel like, I've been doing this for so long, but you get paid more than me because you have a bachelor's.
That's where the beef come from.
I get it. The picture is being painted.
Okay.
It is just
like in some places,
You know, that's personal though. You know what I mean? So you can't get mad at someone for making more money than you, and that's like a hospital policy. Like, come on, nurses, don't eat your young. Don't eat your young. Please help the younger generation.
Embrace them and teach them.
Yes, absolutely.
You'll see some older nurses like, I've been doing this for 55 years.
And I'd be like, go sit down somewhere because you're not doing a good job.
Got in there.
You got in there.
You got Alzheimer's, hon. Yeah.
And you have a lot of young nurse practitioners.
Question.
You have a lot of young nurse practitioners because they could start high school. They could start it in high school. And by the time they finish high school, they're already
nurse, associates.
Is there opportunity like to get promotions. Let's say you start let's say you charge nurse. You're like, oh, there's an opportunity. I'm just saying, let's say there's a charge nurse, and then you're like, you know what? There's an opportunity here. There's a vacant spot. Can I apply for that?
You can apply.
And then what?
Yeah, like a director of nursing. Like a director of nursing position or assistant director of nursing. Yeah, you can go from charge nurse and definitely move up. Mm-hmm.
Now, is there a hierarchy? Like you can't, because you're the last one hired, you can't be promoted to be, you know, is there a hierarchy?
No, but
I think it's based.
There's caps. There's caps on pay.
There you go.
There is caps on pay.
Are there caps on pay? Have you experienced that, Brittany?
I have not. At the time, I mean, for the longest, I was making like $10 an hour. So when I first started off as a nurse, and I was making 16, that was a come up for me. You know what I mean? So, but I haven't noticed any caps on as far as salary, especially now in this pandemic. You know what I mean? They're like, if you're a travel nurse, you can make like $8,000 a week if you're an RN.
For that, but there definitely is caps.
Well, let me ask you, as a nurse, because of the COVID, and what advice would you give to those that are on the front lines fighting and seeing COVID patients, and and just understanding where they're coming from? Because even though you are not experiencing necessarily the front line, what would you say to those frontline workers out there to let them, during this pandemic?
Just want to say thank y'all so much for y'all service and your everyday sacrifice. I know y'all risk going into work every day and exposing your family members. So thank you so much. Wear your mask as much as you can. And that's for the general population as well, too. A lot of people say, well, I don't want to wear my mask, but the mask not only protects yourself, but it protects other people as well. And just stay positive, seriously, because during this pandemic, it's definitely a time where you can get down and depressed and with everything that's going on. So be there for each other. Seriously, stop with the QAM, stop with the LPN, RN, CNA, just really support each other and just be there for each other. Just be a listening ear, because we're all going through some stuff right now.
Yeah, that's what's up.
I definitely agree, Jay. This shit sucks as a frontline worker.
Yeah.
Some of us see patients every day.
Yeah. Every day. See, I think as general population, not necessarily me, because like I said, I have a family full of, full of healthcare workers. I think just your average Joe person, they don't really understand. They just think that nurses will be there. That's their job. Do your job. But they don't understand the ramifications behind seeing people die day after day after day, 2, 3, 4, 5 day after day. And you're trying to save their life. You're trying to put all you got into this person to try to save their life. And I think a lot of people, we walk this earth and we don't even have that as a second thought.
Yes. Yep.
So that's why I say, when I said about our episode, that it's a thankless job. And I think that all of us Americans that are not in the health field need to stop and say, you know what? Thank you. We appreciate you.
They appreciate them now because they realize.
But you should appreciate them before the pandemic.
People are blind
because when your child is sick, when your child is
breathing, when
you're calling an ambulance, when your father's having a heart attack, when your mom is having dementia episodes.
Yes.
They're always working. They don't stop working, because when the pandemic goes away, we're still going to be working.
Yeah. Yeah. I mean, this is, and do you think that, would you say before, because I'm sure the position you're in now is great, would you say that you've ever been as a healthcare worker, would you ever say that there's been a point where you felt like you just never got any thanks or appreciation for what you did?
I know this might sound, like unbelievable, but I really don't look for recognition, because I feel like this is just who I am as a person. I love caring for other people. I love just doing what I can, using my skills to just possibly heal someone, you know what I mean? So I don't look for thank yous. It's always nice to get recognition and thank yous, but it just really comes from my heart, seriously. So it's just what I do.
That's what's up.
Yeah, you sign up for this. You know what you sign up for.
But it's also a positive note when you see that person from like being dead till like walking out the hospital. You the one that took care of them and got them out there. I mean,
Yeah.
so you,
Of course, yes. That's the goal, that's seriously the goal, but
That's what's up.
I ain't gonna lie.
So I also want to thank like all
Everybody,
the essential workers, the people that are at the
EMTs,
supermarkets,
LP, everybody.
even the
Yes.
non-healthcare workers that are out there that are at the supermarkets. They're open so we can eat, so our kids don't die. So this and
Yes.
that. A lot of times I be at the door like make sure you wear your mask.
Yes.
Like it's crazy that you gotta constantly be saying it, but it is what it is.
Yeah.
I want to
For
thank the shoppers who are at the stores, and when I couldn't get my own groceries,
the
just
Instacart
went and
workers.
shop for me, and I just went and picked it up. They put it in the trunk, and I was able to go home. So thank y'all for that service.
The people that are
shoppers. I mean, I'm out there picking my own stuff. Like
the people that
Mhm. We was in quarantine. We had to do what we had to do to make sure we ate, y'all.
Oh wow!
You gotta get the people that come deliver your food.
Yeah.
Like taking that chance, even just walking up to the door to put the food down.
Yeah,
it's a lot of people out there that are actually helping throughout this pandemic.
Yeah, that's super dope. I think that you're super dope, Brittany. My hats go off to you and all your colleagues and your coworkers.
Thanks, guys.
We're sending virtual hugs and love your way for sure. Many prayers, I'm sure. We will definitely keep you and your family in our prayers. And we appreciate you for being on tonight.
No, thanks for having me. I feel super special to be the first guest on Ratchet Tea Podcast. I'm going to put it on Facebook.
Yeah, for sure. And we're going to, just being so awesome, we're going to send you a little something just to say, as a token of our love from Ratchet Tea Podcast, just a little thank you. So when you get it, just know it's from us.
Oh, thanks, guys.
Yeah. So...
All right. Can I say something? If you guys ever do like a podcast topic on HIV, I told y'all that I worked in that field before and I really love it. I like to get information out there, and so we can end the stigma about HIV in care, because there's still stigma against people living with HIV. And hey, get out there and get treatment. Guess what? If you have diabetes, you're more likely to die from diabetes than HIV. If you are being treated, okay? So we got to get the information out there.
Well, listen, we're all for it. You just, after this podcast, we'll definitely check your schedule and we'll have you on. We'd love to have you on again for sure, because we love to spread information for the people, to give them that knowledge, to, because we want to better our community and we want to better our loved ones and people that look like us. And even some of the people that don't look like us, they need to get some of this information
because
too.
A lot of people are very, very, very much not educated on a lot of this stuff.
Absolutely.
And a lot of people do not know that you can die faster from diabetes than from HIV.
Absolutely.
Well, how about that?
Oh,
pick that up. Okay.
How many limbs you could lose over diabetes?
Yes, we know. Yes.
A lot of people don't know that.
Yes, I know.
A lot of people don't know that a little scratch can cause you to lose a limb.
Yeah.
Untreated high blood pressure, you're more likely to die from that than treated HIV, guys. Come on. We're going to be all right.
We just want to thank you from Ratchet Tea Podcast.
Yeah,
we appreciate you. Everyone that's watching, her name is Brittany Richardson. Follow her on Facebook. I'm sure she's going to be posting great information for you guys. She's a nurse from North Carolina, and we appreciate you.
Yeah.
Thanks, guys. I love Ratchet Tea Podcast.
And we love you back.
Bye.
Bye.
No outro?
No answer. No. We here. Don't go nowhere. All right, guys. So we are back. We're Ratchet Tea Podcast. That was our guest, Richardson. Super dope. I think that's super dope. I think everybody needs to watch this podcast. I think you guys need to get some of this information. And if you're thinking about going into the healthcare field, watch the episode. Coming straight from a nurse that lives in the field, works in the field. Another person right here working in the healthcare field. Drop us a DM. You know what I'm saying? If you want further information or just, further guidance. That's what we're here for. We're here for the people.
Nuggets.
Little nuggets.
Right.
So y'all got anything else?
Oh, that's it for me.
Man, I think the tonight's show was super dope, super great. Don't forget to follow us, like us on Facebook, Instagram, YouTube, Spotify. Help us get to 100,000 viewers on all platforms.
Right. And again, a big, huge thank you to all the essential workers,
Yes.
frontline, EMS,
Yes.
nurses,
Yes. Publix,
Publix,
Burger King,
right, Uber drivers,
whoever made my Impossible Whopper today. Thank you so much. I appreciate you.
everybody that's out there.
Yeah,
in the
everybody
midst of
that's
this
out there.
pandemic,
Yes. Yes.
instead of collecting
Yes.
unemployment.
Remember, wear your mask. Keep not only
Get shot
yourself
for that.
safe, but keep somebody else safe.
Yeah.
Because let me tell you something, when you wear your mask and they wear their mask, not only are they keeping you safe, but they're keeping your family safe.
Right.
So, all
I
right.
know.
Utility workers, yes.
Yes,
Keep them-
utility, yes. Keep them lights on.
the
Shout out to
linemen
you
be out
guys.
there.
Yes.
You know, yeah, I love people.
Yeah,
The
man.
linemen, they be out there.
They be out there.
Yeah,
They
they're
do.
essential all year round. They're
All
essential
year.
when the hurricanes,
Yes.
when the snowstorms.
Yes, yes.
Shout out to you guys.
Help us keep our water and lights on. So shout out to all you guys. So we appreciate you guys so much. I think I am Menda Renee tonight.
Right. I'm Wanda Li.
Your boy Etienne.
Catch us Sunday, right?
Right.
Yeah.
7:00. I don't know what we're gonna be talking about, but we're gonna try to make it juicy for you guys. So until then, have a wonderful week. Be blessed. Wear your mask. Stay safe. Thank you to all the frontline workers, all the essential workers. And until Sunday night, we're gonna say peace.
Do your thing.
Get your